Hello, my name is Christopher Ayala, and my presentation is on case study 6C, which is part of diseases of the genital urinary system. In this presentation, I will go over the case study scenario, key terms, and answer the case study questions and give a pathogen profile for the organism related to this condition. So, the scenario, you're working the night shift on the answer line. A telephone service provided by a health management organization for its enrollees. You receive a call from a 26-year-old woman. She has been experiencing dysuria for the past 24 hours. This is the first time she has had this condition, and she describes herself as otherwise healthy. My only key term was dysuria. Dysuria is a symptom where a person feels pain or a burning sensation when they pee. Both men and women of any age can experience dysuria, but it is more common in women. So the first case study question is, what are some of the first questions you should ask? Some of the first questions I would ask are, do you feel burning, stinking, or itching when you urinate? Do you feel the urge to urinate often, even if little or no urine comes out? Do you have pain in the lower front part of your abdomen near the bladder? Do you have any pain in your upper back or side? Have you had a have you had a fever or chills? Have you noticed cloudy, bloody, or strong smelling urine? Have you had any recent sexual activity? Do you have redness around the opening of the urethra? Vaginal discharge, vaginal itching, pain during sexual activity, or a bad odor? I would ask these questions because dysuria can have different causes, so the extra symptoms can help narrow down whether it is a bladder infection, kidney infection, uri- urethritis, vaginitis, or another condition. Question number 2 says the patient reports a fever of 101.5 degrees and a nearly constant urge to urinate, though she often voids little or no urine. What is your preliminary diagnosis? Now we are getting a little more background about her symptoms. Based on this, my preliminary diagnosis will be a lower urinary tract infection, most likely cystitis, because it is one of the most common causes of dysuria. This is because she experiencing dysuria, a fever of 101.5 degrees, and a nearly constant urge to urinate even when she voids little or no urine. Cystitis is inflammation of the bladder most often caused by bacteria. It can be painful and uncomfortable. If it's not treated quickly, it can become a serious health problem if the infection spreads to the kidney. Her sign of fever could mean the infection is getting worse. I also added this image because it shows a lower urinary tract infection. The arrow points to the bladder area, which connects to my preliminary diagnosis of cys- cystitis. This helps shows the cystitis is the lower urinary tract infection involving the bladder, not the kidneys. Question number 3 says, there is a certain symptom that she has not mentioned. What is it and why is it important that you ask her about it? The symptom she has not mentioned is whether she has pain in her upper back or side. This is important because if she has upper back or side pain, it could mean the infection has moved from the bladder to the kidneys, causing an upper urinary tract infection known as pyelonephritis. This makes the condition more serious because pyelonephritis is a kidney infection. It happens when bacteria move from the bladder up to the kidneys. It is also considered more serious than a lower urinary tract infection because a kidney infection can lead to life-threatening complication, especially for people with a weaker immune system. This is why asking about upper back or side pain is important because it helps tell us the difference between a simple bladder infection and a more serious kidney infection. Question number 4 says, what is the most likely causative organism for this condition? What is the route of transmission of this organism? What are some other causative organisms for this condition? Well, the most likely causative organism is Escherichia coli. The route of transmission is the bacteria from outside the body enter the urinary tract through the urethra and then multiply in the bladder. This can happen during vaginal intercourse, anal intercourse, from improper hygiene, poor bladder control, or not fully emptying the bladder. Other possible causative organisms for this condition are Klebsiella pneumoniae, Proteus, Enterococcus, and Staphylococcus. Here I have added a picture of E. coli, which is the bacteria most commonly linked to this type of urinary tract infection. The characteristics of E. coli. The scientific name is Escherichia coli, also known as E. coli. In this case, the disease names are urinary tract infection, cystitis, or bladder infection. If the infection spreads to the kidneys, it can also cause a kidney infection. For the type of pathogen, E. coli is a bacterium. It is a gram-negative rod, which means it has a rod shape and stains gram-negative. I have also added a microscope image of E. coli to show its rod shape and gram reaction. Some special structures that help E. coli cause disease are fimbriae or pili, which help it attach to the urinary tract, and flagella, which help with movement. The main symptoms include dysuria, constant urge to urinate, little or no urine, blood in the urine, cloudy or strong smelling urine, lower abdominal pain, and fever. If it spreads to the kidneys, it can cause upper back pain, chills, nausea, and vomiting. The port of entry is the urethra. Bacteria from outside the body enter the urinary tract through the urethra and then multiply in the bladder. Treatment usually includes antibiotics, and drinking water can help flush bacteria from the urinary tract. There is no vaccine. Prevention includes good hygiene, wiping from front to back, urinating after sexual activity, and not holding urine for too long. And for my last slide, here are all the references I use for my presentation. Thank you.